One of the key questions is, why do patients with POTS have a high heart rate, and especially on standing? The main problem is that there's not enough blood getting back to the heart. The heart can only pump the blood that it sees. If the blood's not getting to the heart, the blood won't leave the heart, and that poses problems, because when you need blood to the muscles, it's not there, and then the only way the heart, you can increase the amount of blood supply is really to increase the heart rate, which has its own problems, as you know. We know most patients, when they feel really unwell, lying down, they improve a lot of the symptoms. And one of the key reasons is that you've eliminated the gravitational pull of blood away from the chest to below the chest. And the blood comes back when you lie down. That can improve the blood flow. Today, there are some interesting experiments to show the effect of increasing and decreasing preload on the blood supply that we can now track and measure at home using this novel Lumia device.
Bobby is our most compliant volunteer ever, who has gone through open heart surgery and has brought the heart out. So that's the blue balloon that you see there that the thumb is going to be pressing. So you can see the heart fills, and this is beating at 60 beats per minute, about once per second. It's normal heart rate. You see how the heart is not filling all the way. So the balloon is still kind of wrinkly. And that's because it's not getting enough preload. But now we're going to put the legs up, so the gravity is going to push the blood in the legs to fill the heart better. And now you can see that the heart is actually being filled fully before it squeezes each time. So that's why it's able to squeeze a whole lot more blood, because your heart can only squeeze out the blood that it gets to, as Dr. Raj covered. And that is the basic principle that we'll be covering in today's Lumia Lab Live.
Science always starts with a question or a hypothesis. And today what we're going to test is whether blood flow does improve with putting legs up in people with orthostatic intolerance. I'll explain the 4 steps of the protocol. We're going to hold each one for 3 minutes. However, if you feel lightheaded or any symptoms while standing, you can cut that short. So if you want to do the experiment here or afterwards, all you have to do is start a live mode with your Lumia. You have to have a Lumia to participate in this experiment. So you can collect the data in your own time. Are you ready to collect some data?
We're starting now. So official 3-minute has started.
Ultimately, the heart needs to deliver a certain amount of blood to the body to do its things. And when you're exerting yourself, you're using your muscles, you need more than when you're not doing stuff. And we measure that with something called cardiac output, which is, a measure of how much blood is delivered per minute. Right, so cardiac output is made up of 2 things. One is the amount of blood that the heart delivers with every beat, called stroke volume, and the heart rate, the number of beats you have in a minute. Right, so it's actually fairly simple math, and it's stroke volume that's really the key that's affected by preload. If you aren't delivering as much blood to the heart can't move it forward. Right, the heart, can only, as Wouter said, the heart can only, push out what comes in, what it gets. And so the goal here with increasing preload is actually to try to see if we can get the heart to increase its stroke volume, the amount of blood that comes out every time. And then the hope is you don't have to raise your heart rate as much to get the blood that your body needs in a minute. And you have less tachycardia and hopefully less symptoms with that. The other part of this is that, I'm a cardiologist and I'm focused on the heart, but it turns out my neurology colleagues keep telling me the brain is more important. And one of the things that we know is that when, the heart's not delivering as much blood, that can actually compromise the blood flow in the brain. And the hope is that these maneuvers, by making the heart more efficient, will actually improve.
Sorry to interrupt, Dr. Raj. We have 10 seconds before the transition to legs up. So Maggie, if you will, in about 10 seconds, let's go 9, 8, 7, 6, 5, 4. All right, Maggie's going for it already. Go for it.
Making the point that the brain blood flow is affected, and that's actually an area that has become, it's been around for a while, but I think there's a lot more interest in trying to understand the issues around brain blood flow and potentially reduced or compromised brain blood flow in patients with POTS and related disorders.
You're actually going to be transitioning to a standing. I missed the 3-minute window, so we're going for the 4-minute window. So I suddenly made legs up go for 4 minutes, but at 7:49. So as you can see here, in about 15 seconds, we're going to be going ahead and transitioning to a standing position. So let's go in 10 or 5, 4, 3, 2, 1. Go ahead, Maggie. All right.
Let's see what happens to Maggie. Maggie does not have orthostatic intolerance. What are some practical ways that people can try to increase their preload?
So, we try to target the two problems that we've talked about. So the blood volume is low, and we want to try and increase the volume. And that's where I suspect almost everyone watching today has been told to try and increase the amount of salt they take in their diet and to drink lots of water. And these really are part of a fluid retention strategy designed to try to increase your blood volume. That's why we do it. There are drugs used on top of that, but non-pharmacologically, really, this is a foundational treatment. And, it's important that it be done aggressively. The other part of it is that, most patients, as we said, get their symptoms when they're upright and better lying down. And that's because fluid shifts downward because of gravity away from the chest. And so we've done a lot of work here in Calgary, led by Kate Bourne when she was doing her PhD in our lab, looking at lower body compression. We're big fans of using compression garments, compression tights, from the abdomen all the way down to the legs. The most important area is the abdomen and pelvis. You don't want to wear just knee-high socks for this purpose, but the compression it doesn't eliminate this fluid shift, but it decreases it, allowing more blood to keep coming back to the heart realistically, and helping lower the heart rate on standing.
So what we can see here is during the laying period, actually first, sorry everyone at home, I'll count you down because we're going to go ahead and lay back down. And let's stay focused on the next action, and then I'll explain what's happening. So we'll give it in about 10 seconds. We're going to go ahead and lay back down in 5, 4, 3, 2, 1. Can you go ahead and lay back down? I'll start to talk about what we're starting to observe here. As you can see, Maggie, when she was laying down, is not that fluid responsive. When her legs were lifted up, she had a small increase, but not a significant increase in flow with more blood filling the heart. If it's already getting almost filled, then pushing in a little bit more is not going to push it up that much more. But if your heart is very underfilled, if the preload is very low, putting your legs up can fill the heart a lot more and increase your flow a lot. After we saw a pretty steep drop, and this is actually quite common if you've been laying down, especially if you put your legs up for a while, when you get up, you're going to have a kind of steeper drop, but it's the recovery from the drop that matters. Usually you need to see for like 10 minutes in order to really start to see someone that's really orthostatic intolerant look different than someone that's not. You can see Maggie was slowly starting to climb up as her autonomic system was squeezing the blood vessels in her legs because the blood went down to her legs and it was starting to squeeze it back up. So we were recovering slowly, but we laid back down before we could really let it fully recover. And when she lays back down though, all of a sudden, all that fluid that gravity was pushing into her legs when she was standing up is rushing back into the heart. So we see this significant effect because gravity is extremely strong on a column of fluid, which is basically a human body. These are all related to preload. It's all about how much gravity is acting on your blood in your body to push it towards your heart.